Okay, so one way to mobilize the hip, and I'm going to show one where I'm helping her, is a lot of times that we have to clear hip impingement, which is oftentimes found with knee conditions such as Pezan-Serrani bursitis. So all we're going to do is we're going to wrap this thing up as close as we can to her groin, and I like to use 2 because it also adds more tension, but also too it decreases the amount of like pull into the area and tenderness she's going to get from the actual strap going just into one spot. So here's what we're going to do. Let's see, make sure you can see. So I stepped through the band right there. What's a better way to do this? Let's spin that way. Spin, there we go, right there. Cool. All right, don't kick me. Just like that. So I'm going to draw tension this way with the band. And all I want is I want her to engage your trunk here. Okay, act like I'm going to punch you. Don't let me sink through your stomach. And she's going to drive her knee up towards her chest. Good, as hard as you can. And come on down. So the more tension I put on this, the more I'm going to distract the joint laterally. Go ahead and come up. And she's actually just adding movement into flexion, which again we talked about. Go ahead. We're going to do this about 10 times. We talked about the correlation of knee conditions with hip ones. If we can improve the hip range of motion or mobility, then we're going to improve the knee. And in this case, she's having to do all her own mobility work. I'm just providing the lateral distraction to improve the joint space. Good. Now, one way we can have her do this on her own is, let's see, if you were attaching this, imagine I'm a rig or some type of baluster or something of that nature, then she could do this all on her own. I like to have them attach it so it's a little bit above the hip up here, because the whole point is to get from here to here. And if it was down here, then it's not going to work quite as well.